The Belgian National Environmental and Health Action Plan, or also called NEHAP, is a consortium of health and environmental government administrations who occupy themselves with topics where health and environmental policy intersect. This includes tackling exotic mosquitoes and ticks, gathering knowledge about the impact of ozone and heat on health, but also reducing the impact of the healthcare sector in environmental emissions. Reducing the environmental impact of the healthcare sector is a vital but really complex task. Greenhouse gas emissions come from a large number of sources, including heat and electricity, of course, but also anesthetic gases, catering, and emissions from the supply chain. For example, the supply chain of pharmaceuticals account for around 30% of Belgium's healthcare emissions. Moreover, each type of healthcare provider is structured differently with a different path to decarbonization. Many great initiatives exist in Belgium to reduce the healthcare sector's emissions, coming from both governments, but also bottom up from the healthcare sector itself. Many great initiatives exist in Belgium to reduce the healthcare sector's emission, coming from both government agencies and bottom up from the local healthcare sectors. However, many of these initiatives are carried out locally. It would be great to know more about what's going on exactly and to share the knowledge gained from these initiatives with other hospitals, practitioners, and governments. Currently, we lack an overview of what's going on exactly. Daphne is an EU Interreg project to decarbonize the healthcare sector in EU regions. Through Daphne, we can learn about the problems that other regions are facing regarding decarbonizing their healthcare sector, but also learn about the innovative ways in how they tackle these problems. Belgium takes part not as a region, but as a country, as we saw the opportunity to learn about how other regions are facing these problems in decarbonizing the healthcare sector, but also widen our knowledge of what's going on exactly within our country. Through consultation with local stakeholders, as well as regular meetings with our EU Daphne partners, we are building knowledge of best practices on how to decarbonize the healthcare sector in Belgium.